Yes, so our study was looking at inflammation and outcomes in stage 3 colon cancer. And we know that inflammation is important both for colon cancer development and progression. So we were curious how inflammation related to diet would impact survival outcomes, specifically in patients with stage 3 colon cancer. So we used a validated tool for measuring the inflammatory potential of a diet called EDIP, or empirical dietary inflammatory pattern. And by applying this to patients' self-reported dietary data, we were able to calculate an EDIP score where higher scores correspond with more inflammatory diets. And we found in our secondary analysis of a phase 3 clinical trial that patients who consumed more pro-inflammatory diets had worse overall survival compared to those who consumed the least inflammatory diets, and that physical activity and diet together could impact survival. So we saw the best survival outcomes in those who had higher levels of physical activity and consumed less inflammatory diets compared to those who had less physical activity and consumed more pro-inflammatory diets. So the methodology of our study, this was a prospective cohort study and a secondary analysis of a phase 3 clinical trial called CALGB SWOG 80702. And we used a Cox proportional hazards model to model the association between the exposure, which was inflammatory diet, and the outcomes, with a primary outcome of disease-free survival and a secondary outcome of overall survival. For disease-free survival, we did not find a statistically significant association between inflammatory diet and disease-free survival in a multivariable adjusted hazard ratio. But for overall survival, we did see a statistically significant difference when modeling EDIP against overall survival. So I think that this study adds to the body of literature that we have that diet may prolong survival in stage 3 colon cancer. Our study results looked at an inflammatory dietary pattern, but they are not a dietary recommendation. And so we need further studies to be able to tailor our findings into dietary recommendations for patients. So I would say that we are encouraged by the results that show that there's a way that we potentially could look at diet as a way to improve survival in stage 3 colon cancer. But based on our study results alone, I would not recommend dietary modulation, and we need further studies for that.